myths of psychology among psychology budding students, psychologists, as well as other normal population we have in our society. And we
Yes,
will take up doubt sessions as well.
definitely.
Yeah. I think we are good to go.
Yes. Shall we start? So it's like 4. So as we progress, don't join.
Yes. Hello, keep joining. Hello, Vasudha. Thanks for joining. Dr. Hari Vignesh.
Hi to all the participants, those who are here. Thanks for joining us.
All right, good evening, everyone. I am Nikita. I am a psychologist working at Athena Behavioral Health, as well as I am running a therapy workshops. I am holding internships, and I am associated with Salute Minds as a psychologist and taking sessions over there. Let's introduce our guest for the evening, Dr. Hari Babu. He is a psychologist and a managing director at Heartfulness Counseling Center. He has his own setup in Tirupur. We'd like to hear from you, sir. Over to you.
Yes. So, hi guys. Good evening to all. So I'm Haribabu. I'm a managing director and psychologist from Heartfulness Counseling Center. And I'm also a part of district family counselor in Tirupur district. I'm under social welfare board. It's a project based NGO project based work. So we used to travel a lot of places to counsel family issues, conflicts, marital conflicts, sexual dysfunction related issues. So I was having an idea to discuss the session based on this myths behind the field of psychology. There's a lot of controversial talks or controversial discussions or some kind of doubts, some kind of uh, guilt conscious, those who are inside the field and outside the field of psychology. So I was discussing with people how to deal with this, how to break this myth, how to break the stigma. So let's have this discussion of how to break the stigma of psychology and the difference between the psychiatry and psychologist. So all these things we are going to discuss. So you can all raise your questions. So we will be answering in the end of this session.
Yes. So let's start with the layman term. What is psychology and how is it different from a psychiatrist? What is the role for a psychologist in our society, as well as how does it differ from a psychiatrist? Because many people get confused whom to reach to, because they are able to identify their family members with some symptoms. They are able to identify their own symptoms and their own problems in day-to-day lives, but they are actually struggling to find where to go to, whom to approach, and what is the appropriate way. Should they or not? They are always in a doubtful state. Let's clear them up first. Please take over.
Yeah. So in this society, there is lot of advancements has been day by day. It's increasing. There are a lot of professional peoples are growing day by day. New type of invention and professional fields are growing day by day. So nowadays, people are so confused with two people in the same profession, whether we have to travel to psychiatrist or whether we have to travel to a psychologist. So there should be a difference between a psychiatrist and psychologist. See, the basic problems or day-to-day problems, if you're not able to solve it, there is a person to listen your problem, listen your queries, listen your worries. So that kind of profession only the psychologist plays. We are here to listen your suppression thoughts or negative thoughts, what are the day-to-day feelings, emotions you're undergoing in your life, day-to-day activities. We are here to listen your words. So maximum of problem while listening, while pouring out your issues to the confidentiality person or your trustworthy person, whoever it is, that we are saying that we are so confidential in your issue and we are so trustworthy person, we will make you the comfortable place or environment, what all you want from us. We make you the comfortable zone, we give you the comfortable zone to discuss your personal issues. So we are in a manner, we are in a place of listening the people issues. So people has to understand the psychologist is a person who are the trustworthy and confidential person to listen your queries, where the psychiatrist is also a person where we are not able to guide or we are not able to solve the issue with our technical support. Then only we will transform the person to a psychiatrist. Though there is not needed for a direct visit to a psychiatric person or psychiatrist. There is a issue, two kinds of issue. There is a severity of issue and minority of issue. So two as a problem difference. So people have to understand which kind of problem we have to lead to a psychiatrist, which kind of problem can be dealt with psychologist. So as the issue is in a simple stage or in a manageable stage or whatever it is, that kind of problems can be dealt with psychologists. When it cannot be adopted or cannot be handled by the psychologist, then we can transform the client or the person to a psychiatrist for a medication process. After a certain period of medication, the people can be brought back into a normal life and they have to lead for a certain stages of counseling sessions. Only the medication or only the psychotherapy or psychologist process cannot be cured soon. So if the person goes for a psychiatry, at the same moment he has to travel for a psychologist also. So then only he can get a result as soon as possible. Once the people are believed to a particular practice of psychiatric or psychologist, the result may take a longer duration than the normal process.
Great. I also understood from this perspective that both have certain roles in, managing our symptoms or disorders or, any problems which we are facing in day-to-day lives. But it's important to approach because we are actually raising and trying to raise awareness about, how to reach to a appropriate mental health advocate or how to reach to a psychologist. Well, this brings me up to another question which people are hardly, known to, which is what is the difference between a mental health advocate and a psychologist?
See, mental health advocates is also a term who are so activist, a person so involved to create an awareness towards in the field of psychology or towards in the field of mental health. The people has to understand and they have to break the stigma. So many kinds of people are taking initiative to break the stigma of mental health. So many people can transform the term as mental health advocate. So they can be in a different a major of different kind of occupation or different kind of field, but they have an interest that they have to understand the basic awareness of mental health, the importance of mental health. Those people make it as a term as mental health advocate. They cannot be a mental health person. They can be a mental health person or they cannot be a mental health person. So state that mental health advocate is a person, those who are activists in the field of psychology. They can be a psychologist or they cannot be a psychologist. So that is not a problem at all. They are also making an initiative part in our profession to make an awareness in the day-to-day activities, and they should understand the people that mental health is so important. So kindly accept your issue, kindly trust your issue, kindly trust the professional people whom you are discussing the issue. So there is a myth behind this issue. So all this myth has to be broken or whatever it is. So that part has been taken by some other people from out of the field of psychology. So they are termed as mental health advocate. So the psychologist has the people, a professional people, those who have come from the undergraduate, postgraduate, then master philosophy, then post doctorate. Also, they have done in psychology. So these peoples are there to guide your issue. These people are the professionally skilled people to handle your issue or handle any kind of emotions. So you don't need to get any kind of guilt conscious to share your problem. Without sharing, after leading into a certain stages, when you realize, you will be taken into a guilt conscious that I have done something wrong in my life. I have taken a wrong path in my life. All these queries will create a negative thoughts in your life. Then you create again a suppression. The intensity of suppression creates lot of illness. So the mental illness will get connected to a physical health. So automatically, after getting some kind of fever or headache or whatever it is, but after giving certain kind of medication also, you will not understand that why I'm not healing, why I'm not healing. Again, it is a doubt. Again, you will get into a doubt that I'm taking all kind of medication. I'm visiting all kind of practitioners. I'm visiting all kind of specialized peoples. But then even though I'm not healed, that means you are not physically ill, you are mentally ill. That is the basic ideology or basic understand that after giving all kind of medication also you are not healed means that means you are mentally ill. You are getting into some kind of mental related of basic problems. You are not into a higher level of problems. You are into stepping into a psychological issues. That is the sign for this kind of problem. So don't need to worry about requesting the psychological people or approaching a psychological people. Don't need to worry about it. It's for your betterment. We are here to guide you to take a better decision to get better solution for your problem. That's it. Nothing to worry about that. All the psychiatric people or all the psychiatric professionals will give all kind of sleeping pills. That is a major stigma spoken by the people.
Have we connected?
Yes.
Yeah. Well, thanks for giving us the direction. What is a mental health advocate? This also brings me up to an example for which it will be convenient for you all to understand. So, remember Dr. Hari Babu. So, we also have some organization called Alcoholic Anonymous. Yeah.
Yes.
I think this can be an example of a mental health advocate, how it works. So once you, maybe a person is addicted to some drug or alcohol for that matter, and once they heal themselves by taking any help from a mental health professional, it can be a psychiatrist, psychologist, or any mental health advocate, once they are healed, they understand the root cause of the problem. They're actually able to identify their symptoms, their causes, and everything that makes them into that problem, which later on helps other people to get out of that problem. This is how mental advocate works. So you can also check this out, the organization name Alcoholic Anonymous.
So many people have this mental health advocate. Nowadays, we are seeing that mental health advocates. As the years of 5 years or 7 years back, there's no term called mental health advocate. Only psychologist, psychiatrist, or psychotherapist or counseling psychologists, all the specialization peoples only we have heard it. But recently, like past 2 3 years or 4 years gap only, this mental health advocate as a fashionable term has created and shown that we are also here to listen your problem. We are also here to guide your problem. So all these kinds of issues are coming, but people can get the ideas from the people to whom we have to reach out for the better solution. The mental health advocate kindly refer their qualification or whatever it is. Then get into the discussion of your personal queries. Don't directly jump into the mental health advocate. So their referable person is so close to us. So directly we go and directly we share the issues. Now, in the beginning, you will not understand that you are cured. Later, after 2 to 3 sessions, then only you realize, still then I am not feel comfortable with my solution. Then only you feel that this person is not suitable for my issue. Then after that, you will go for next person. If you keep on shifting your issues, indirectly, you mean that you are publicating your personal issues to various people. So that creates another issue that creates some kind of suspicious behind any incidents. So you are creating an issue more further and further indirectly. So kindly understand the people concept or people professionals. Then discuss. Kindly know that what is the professional qualification about the person whom you are referring, whom you are going to meet. Kindly discuss the personal doubts or personal queries about the people whom you are going to meet, whom you are going to discuss about your personal issue. Don't believe blind. Okay, so kindly understand the people's professional qualification. After that, if you discuss, you can get some kind of at least a 10 to 20% of changes you can feel from the qualified professional people.
Correct. Thank you for sharing this. This brings me to another question, Dr. Hari Babu. I would like you to address that part. So many people are having myths about the symptomatology. So people are actually confused whom to approach. That part you have already explained. So let's come to that, how people are actually, always asking the other person, what are the causes I have developed this symptom? Which therapy to take? There are and many population believe that we are just talking. How can talking heal a person? This is just a talk therapy. We can talk to our family members, we can talk to our friends for that matter. Why should we approach to a psychologist?
Okay. So this is another myth of another stigma that people speak. But mostly people speak the psychology or psychiatry people will give only pills. The next question comes, you are also a common human being. We are also a common human. What is the difference between the psychologist or the normal people? See, the normal people will give you an understanding or explanation from their life experience. That life experience belongs to their environmental factors, their personal factors, their family factors, their educational factors. All other factors will play the role and brought them better understanding for their personal growth. But that doesn't relate to your personal growth. See, each individual has each differences. The minute and mild differences will bring a moderate or mega changes in your life growth. So kindly understand, a simple differences also create an issue. So don't take others people advice. See, as a psychologist, we are not giving any kind of advice or any kind of suggestions. We are going to discuss your issue and we are going to create 3 or 4 various kinds of solutions. In that, we are going to create which is more prioritized in that solution. According to the priority, you're going to make a challenge and you're going to take it into your personal life and you're going to make that words into an action. That action will bring you a lot of changes. According to the actions, you will feel what are the difficulties, what are the pros and cons in that solution. according to the priority wise, we are going to guide you to lead a better life. So the people has to come to us to discuss, and we are here to guide a better solution. We are not going to give you or suggest you a solution. We are going to guide you to take a better solution. So the people from us, like us, we will give you a lot of discussions. We will be listening to various problems. We are not going to be in the same kind of feelings or emotions. If you are feeling worried, we will understand the pain which you have undergone through the kind of traumatic experience which you are explaining to us. So we will be listening to your words and pain, sorrow, worries, or whatever it is. It's kind of an understanding that how you have gone through that traumatic experience that you have explained us. So we will be listening to us. If it is a common people, they will just like half the words will be listened, half the words will be thrown outside. So 100% guarantee will not be given by the common people, because the common people also have lot of worries, lot of pains. The same problem will be said. See, you are also having grammar. I say I also have more than this. You, so don't take this kind of issues into your head. That is the advice will be given by the common people. That kind of words will not be said by the professional people. For that, we will be giving the psychotherapeutic techniques which is appropriate for your problem. There are various kinds of techniques, various kinds of methodologies which can be practiced or which can be dealt for the particular individual. See, all the people go through a Google and search that this is my problem, this is my symptom, this is my diagnosis, and this is the therapy. Or directly coming to the professional and say, will you be able to give me CBT? See, CBT is also a therapeutic technique, also differs for each individual. 100% of CBT is not applicable to 100% of population. CBT can be applied for one person, or EBT is different for another person. All kinds of therapy is different for various people. See, another thing, the Google which you serve will give different information. Google is not giving 100% guaranteed information. The Google information is also information which is put up by a non-professional people also. So kindly don't take 100% of belief into the Google matters. So
I
if
think
you believe
yeah.
Google matters, it will bring you another problem of your personal growth.
I think to add more on to that, I think Google gives more information. It's good to learn new things and to get some idea about the problem or whatever the matter is. But it's always recommended that what perspective you are taking, right? So if I talk about CBT also, so there are two things. We say in CBT, our beliefs leads us to our consequences. So, for example, in the morning I get up and say that my day will be good, and I will be, because my sleep is normal, I am eating properly. Today, my day will go good. So definitely, I think if negativities also come or other problems, hurdles come, I will be easily surpassing them and will feel happy. Rather, if I wake up the other morning and say that I don't think so, my day will go good. I have a lot of things to do. My sleep was not good last night. I'm not feeling good. I'm sure my day will not go good. I'm sure that you will start noticing more hurdles for that particular day. Your day will not end nicely. So this is how the normal CBT works, the beliefs and consequences part. Would you like to take on to the affect as well? So we say usually we have ABC model in CBT. Can we explain to the general population, because people are coming into the sessions and saying that we really need CBT sessions without knowing what works for which disorder or what works for which problem. So, for example, in OCD, we can, actually perform other therapies like ERP, exposure response prevention. Why do we go for CBT? This is for budding psychologists. This can be answered, I think.
Okay, this I think the CBT or REBT, all these kinds of therapy are highly taught by the academic peoples. There are many other therapies also, but the importance, the impact has been discussed only with CBT or REBT. All the problems can be dealt only with these two kinds of therapies, mostly. While the academic peoples have been discussing with only these kind of therapies, there are lot of therapies because the psychology is an ocean. So kindly understand CBT and REBT is only a major psychotherapy is what? There are simplified techniques because in our professional setting, CBT and REBT is also a major technique. Other than that, the simple people also will approach us for the problem. So in that, the basic understanding of CBT and REBT will not be understood or will not be applicable for their simplified peoples. The concept based or some kind of thoughts related to CBT and REBT only will work out with this kind of therapies. So I feel that REBT and CBT is not applicable to all kinds of people. So don't come and say that give us REBT, give us CBT. That gives you a superior contact than the professional. The people whom you approach are inferior and you become superior. That is the ideological concept that the people has to understand. Don't come and suggest us the therapeutic technique or any kind of medication to the professional. We are so pleased to say that don't come and suggest us the technique. See, we know that we have to listen your issue first of all. Coming and directly sitting and saying that this is my issue, this is my therapy, give us. So it is like you become superior and we become inferior. We don't want to play that superior inferior card. We want to be in the same level of equal level. Here in this professional setting, we are not superior, you are not inferior. We both are in the same state. No superior, no inferior. The equal state of mind only heals the problem as simplified manner. So kindly understand that no one is inferior, no one is superior. Everybody in a state of equal mindset. So if you are in the state of equal mindset only, the problem can be listened properly. And the people who come to us get benefited from their problem. If you have any kind of guilt conscience within you and you're not expressing out and you're expecting the result, that is impossible at all. That is impossible. Okay. So if you have any kind of queries or negative thoughts or any kind of without having any trust upon the professional and listening and giving your problem or sharing your problem, that will not heal at all. You cannot blame the professional. Having the insecurity feeling within you and blaming the professional, it's creating another issue. So don't create an issues further.
I think it also disturbs the rapport among the psychologist and the client.
Yeah, for that only we have lot of space we have given to share your what you say, your interesting aspect, what you like, what your achievements, all these kinds of things. We don't get directly into a problem. We make you a comfortable zone. We give you a comfortable space. We give you a comfortable setup to discuss. We make you a comfortable people whom you are confidential to share the issue. All this process only we will be dealt in the first and foremost session. So we will be in the introductory session. We will make you the comfortable person and we will make you accept that we are the professional people and we are the person who can guide you the problem. So all these kinds of setups only will be dealt in the first and session. So you can make all the doubts on us or whatever the doubts on our field or doubts on our any kind of doubts you have upon us, you can clarify in the first session. After taking the further session, if you have still doubts, the session will be closed. It cannot be processed. So kindly understand, don't waste your economical crisis, don't waste your prestigious time, and don't waste our professional experience time.
Great words. Okay. Uh, well, you all can keep posting your questions and we'll address them at last. So, well, in the middle, I'm pointing out there's a question in the chat box which says, why do we dream?
Why do we dream? See, the simplified manner to understand the dream is, if you dream only, you are in a state of sleep. You are in a state of sleep. Kindly understand. Those who are getting dreams only, you are in a state of deep sleep. If you don't get dreams, you are not in a sleepy mood. If you are not able to get that dreams, don't need to worry at all. That is also a deeper sleep where you cannot imagine it or where you cannot recollect or recall. That is also a proper sleep. But those who get the dreams, that is a sign that you are having a deep sleep. So don't need to worry about it. If the dream is negative, then approach the professional people to get it solved.
Okay, well, dreams are always associated with our unconscious mind. And,
Yes.
if we see some things or if we are thinking about something in the day, we might get, some more clues to that dream at night. And so this have already followed up with another question which says, are morning dreams true?
See, if you there is a lot of myths behind dreams also. If you discuss the dreams, that will not happen. If you don't discuss the dreams, that will happen. So that is also a myth. If it has happened, that is for good. If it doesn't happen, that will take longer time to happen. So there is no discussion, there is no any kind of myths or any kind of stigmas behind the dreams. Don't create any kind of things. So if you create a doubt on particular aspects of regular activities or day-to-day activities that is happening naturally, don't create any kind of controversies within you. Keep it as it goes. Let it go. Let it travel. Let it happen. All these things, let it go. If you take it in your mind and create a question on the particular event that is taking place in your life, that that becomes a stigma, that becomes a myth, that becomes a controversial topic. So don't discuss about all these kinds of things. Let it happen. You have to accept, even though the dream happens or not happens, you have to accept. When the dream goes into a negative concept or negative role in your in a certain period of time, it takes a week or month or it's in a 2 or 4 days like that, then you have to go for a professional people. Then and there you have to solve it. Otherwise, if you travel with the negative dreams, then it creates another issue with a psychological impact. That psychological impact cannot be said this is the only impact which leads to this problem. Each problem can connect with any kind of psychological impact. The particular symptoms only will connect with particular impact of issue. That is not true. So any kind of symptoms can connect with any kind of psychological issue. So kindly understand, don't get any kind of belief on these kind of things. So
Yeah, so
kindly
it's
get.
this can be concluded as that dreams, we all dream, it's normal, let's accept it. And just a fun fact to add on to that, there is something called dream analysis. So what we dream, we can write or we can, memorize it, because we have the tendency to forget our dreams after an hour or so. So our dreams are always in our short-term memory. So it's better to write them. And just for a fun fact, we also have a field in psychology for its analysis, because it is related to our unconscious, and that's how it works. Okay, so there's another question. Can you explain about how a student with stuttering should be addressed? Is this
Your voice.
I would Can you hear me right now?
Yeah.
So, Mr. Siva Shankar is asking that how a student with stuttering should be addressed. Is it a medical perspective or a psychological perspective? Okay, I would like to add one point to this, and then I'll hand over to Mr. Dr. Hari Babu. So I think it has to be taken care, and it can definitely be treated and addressed. So definitely one is medical perspective. Once we are clear on to the medical diagnosis, uh, are there any biological reasons to it? We need to figure out, and uh, we need to figure out that first. If that is cleared, then we need to get into the psychological perspective, and it's better to get or have involvement with a speech therapist. It can be treated.
Yes.
Dr. Hari Babu, your comments.
Okay. So in this particular issue, we have to analyze all the factors of the case format which we follow. See, we cannot directly come into this is the problem, the person is cannot able to speak or whatever it is. We have to analyze with the deep information about the background of the client. So after that, we have to go with certain kind of formalities of biological evaluation, physical evaluation, then all kind of auditory or all kind of sensational evaluation, all these kinds of things. Then we have to get an assessment based on clinical aspect, on clinical psychological aspect. Then we have to come into a diagnosis of what is the particular issue. As a psychologist, we cannot directly come into a diagnosis of stuttering with a personal or with the sharing of information. Once the people or a child has an issue with an academic or any kind of this kind of speak or vision or whatever it kind of things, and we have to get an opinion from the clinical psychological aspect also. Then we have to, according to their advices, we have to discuss briefly whether we have to proceed with psychotherapies or any kind of special education or occupational therapy related factors, or which kind of factors is very relevant to this kind of issue, because each person individual has each differences. So we have to deal all these kind of factors, then only we have to decide whether we have to deal with medical factors or whether we have to deal with psychological factors.
Correct. Okay, there is another question in the chat box which says, can you give some techniques to my grandmother, to, in case, improving memory, I see. Okay. So I'll say a few words regarding that, and then you can
Yeah.
continue, sir. So I think for techniques, we actually need to evaluate her age first, and then we need to access and assess her. So we need to evaluate physically through psychological assessments, because there are some disorders which are degenerative as per our age. Once we grow, we are, few disorders are tend to induce memory loss or, reduce our memory. So, but for you, you are asking for yourself as well. And you, can I see how old are you? Okay, just a quick question. There is a method called method of loci. For this, I would like to give you an example. There would be definitely some place where you must be keeping all your essential items, or maybe your certificates, your degree certificates, right? So for me, there is a one particular drawer where I keep my certificates. Okay, so this technique can actually be put into our learning method, or a method for recall or for our memory. This technique is known as method of loci. There are certain other techniques which I can bring into. You can actually, for your learning skills, you can maybe make up a story. This will help you narrate and recall those instances or those learning phrases in a more better way. There is another technique or a synonym you can use, which is, you know, what do we call it, sir? It's basically like Vibgyor. It's a technique to learn in a short form. I think this is called peg of word method, if I'm not wrong. You can take it ahead, sir.
Okay. For improvising your concentration, there is a simple technique. Though I don't want to complicate these kind of terminologies also, because I believe in the simplest techniques. So I don't create any kind of controversies because you are already into trouble. I don't want to make you scared of using terminologies of higher and fashionable terms. So I want to use a simplest term. Take three varieties of your grams in your house, which you are having in your houses. Take three varieties of grams, put it into one pot or one vessel. Ask them, is for your grandmother, I heard. So ask them to separate it, keep on separating. So now automatically you get some kind of concentration towards the event which you are practicing it. So automatically that creates some kind of concentration what I'm doing to that, what I'm separating it, which is the three types of varieties of grams. So have a conversation according during the session, have a conversation. What is the grams? What is the benefit of these grams? What were the grams which were used in your lifetime or whatever it is in your childhood days? These kind of healthy conversation can create an interest on doing that particular event. So automatically in a day you can do two or three times a day. So in using different types of grams every day, don't use the same variety of grams, use a different kind of object. You can use three varieties of vegetables, ask them to separate it. You can use three kinds of any kind of material which is used for cooking. That also you can ask them to separate it. So like this, if you give a different kind of technique or different kind of activities, you are keeping them occupied. So that gives them some kind of interest on doing the job. So automatically the concentration also increases for their certain period of time.
Great. Thanks for the information. So, yes, you can, for your grandmother, it's important to evaluate and do psychological assessment before we reach any conclusion. And so, there is another question which says, how should I increase my or boost my interpersonal relationship with my husband? So, your comments.
Interpersonal relationship. See, again I say there is a three boundaries in this particular area. The first and foremost and innermost, the interpersonal relationship boundary is the personal bond. The second boundary is your family bond. The third boundary is your friendship bond. These are the three boundaries which are so effective and so clear and so helpful technique to lead the better life in any kind of event taking place in your life. Okay, so this personal bond is your husband, the first innermost part. So there you have to discuss any kind of issues which you are leading in your day-to-day life, or any kind of happiness or sadness, any kind of moments that has to be discussed. Whom to say, where to say, how to say, all these kinds of questions will be rising in your head that create a curiosity to discuss the particular person. That person is your husband. So have a healthy conversation. Make a visit. Spend your time. Don't discuss any kind of issues in your bed. Kindly, I'm repeating it. Don't have any kind of discussion in your bed. Kindly have a discussion after your dinner and before going to bed. Have a chat with your husband of what has happened today, what is planned for next, and have some kind of healthy and comedy or romantic or what kind of discussion you want to have it with your husband. Have that kind of relation and that kind of discussion, then get into your bed. So if you have a heat conversation, then your interpersonal relationship bond will be broken, will not be satisfied. That is, you will not be satisfied 100%. you're satisfied for a relationship purpose, not for a constant relationship purpose. So kindly understand anything or whatever you want to discuss, kindly have a healthy conversation or what kind of conversation also. Everything has to be taken only in the outside of your bedroom. Okay, so kindly understand on this, then only you can develop interpersonal relationship bond. You can increase the intensity of your interrelationship bond. Have every weekends go outside, don't be inside, have outside. You don't want to go for any kind of shopping purposefully. Go for some outside. Have a chat of seeing whatever you're seeing, whatever you're observing. Have a discussion on that particular events. When you're going for a shopping also, don't need to purchase. Is it needed for our house or is it needed for our life? All these kind of discussion. If it is needed, how can we plan for the things to purchase? How can we plan it? How can we do it? How can we buy it? Within how long period will take to buy it? All these kinds of discussions will create a strong bond in the interpersonal relationship.
Yes, are we connected again?
Yes, I get network issues happening for you.
Yeah, so I was on a question. Yes, probably. So I this brings me to another question, and that myth has to be addressed, which is why do we require premarital counseling?
See, the
Because any
simple
which ways
understanding for
people
this.
think it's going to end in a fight for every relationship.
Yes. What I mean for this simple understanding is, in the olden days, there is no choice for our mom and dad or our grandpa, grandma. There is no choice. Whoever the elder people says they have to marry that particular person. But when the society has transformed into equal rights, equal qualification, equal all these equal terms has been used, the intensity of the word equality has created another issue of these kind of issues where lot of problems are not faced by the couples. All the couples were expecting that I need a privacy, I need an independence, I have studied lot, I have worked lot, so I need an independence to lead my life for my betterment of my personal life. So in that, even though after marriage also they expect the same statement that I know what I'm doing. There is no one to suggest or guide or whatever it is. So they create a boundary among themselves that I know what I'm doing. I want to lead my life, to do myself, everything I. The term when the couples use we, then only the intensity of interpersonal relationship, the intensity of marital relationship will work out. So kindly this process, this problematic issue, we as a professional saying that kindly go for premarital counseling. We give you an idea of the person, we guide you for taking a better progress in your upcoming you a short understanding of your upcoming.
Great. To add more on to that, I think premarital counseling will not include, your future fights, your talks about your issues, which will be in your future. See, nobody can predict future. What we do in premarital counseling is just that, we need to access you on the basis of your compatibility. We do perform some psychological assessments for male as well as for a female. Well, that is not restricted because we have fluidity in gender roles as well. So it works for the LGBT community as well. So we actually try to figure out the compatibility between the two people and then guide them accordingly. How to accept the other person correctly, what issues or problems you might face in the future regarding the other person. Because personalities differ, attitudes differ, your nature, your tolerance to stress differs. So it's important to understand the other person in order to be in a proper healthy relationship. That's the only aim.
So,
Well,
in
and
that, one more thing I want to add it in this. Kindly understand while you are selecting your partner for your life, kindly make understanding in the difference of age. So, the minimal difference is 2 years and maximum difference is 5 years. Don't go beyond 5 years. It is again, it will create a misunderstanding between the ego problems, will create automatically. Even though you accept, like observing his physical appearance or observing his character or whatever it is, you like it, but in the later stages, you will realize that I have taken a wrong decision. So, to avoid and to make a better decision, we suggest you to take the minimal difference is 2 years and maximum difference is 5 years. So, make a clarity in the age difference. So, that's what I want to add in this particular topic.
well, this is a suggestion given by Dr. Hari Babu on, getting married. You can plan accordingly. Okay, so we have another question. Going into lifts can be risky for me. I feel unhappy when I go into lifts. Can this be treated? Well, yes, this can be a part of your phobia as well. You know, uh, Definitely it can be treated. We have certain speculated therapies for that. One is exposure response prevention, which includes your systematic desensitization. There are few therapies, definitely. Your comments, Dr. Haribabu?
Yes, we can also deal with, but we have to understand because this phobia will not come directly in the present life. You have certain kind of childhood traumatic experience that reflects in this particular period or particular event or particular object. So the traumatic or phobia measures will not jump into your life directly. That is very rare occasion that has that to happen. But in your issue we have to deal all these kinds of evaluations of personal childhood, birth, all the developmental stages, all the factors we have to evaluate. Then only we have to understand whether the issue is in the present or in the past. So after understanding all these differences only, we can guide you in a proper appropriate technique. After that also we have to deal with it, we have to leave you in a present life to handle the particular issues. There is a kind of an exposure therapy, or that can be in any kind of therapies. There is a neuro-based therapies or whatever it is that we have to discuss briefly in a evaluative manner. Then only we can come into a proper guidance of therapeutic techniques.
Correct. That was the correct explanation given by Dr. Haribabu, no doubt. So I have ended our question session. Do we have any other question left? You can shoot in your questions. We will be happy to answer so that other people can also be aware.
And a simple understanding that don't come into a psychology or counseling center and ask us, give us some pills. Because I am facing day-to-day practical life, I am facing these kind of issues and people are dissatisfied with our answers. So kindly regret us for giving us such kind of answers. Kindly understand that psychology people are giving a therapeutic techniques which is related like physiotherapy. That's the difference between orthopedic people and physiotherapeutic people. So they are also in the same major, but the professional difference is they are doctor and they are physiotherapist. Okay, same like in the mental health, we are in the therapeutic aspect and psychiatrists in the medicinal aspect. So kindly understand the difference, then get the clarity and then come into the professional understanding, and then you can lead into a direction of any kind of therapeutic techniques. So kindly, I regret, even though if anybody is watching this video, I kindly regret that we are not here to give you any kind of pills. It is against the law of our profession. We misguide our profession in your personal interest. So we want to give a proper guidance to our profession. We respect our profession. So kindly you people also respect our profession and come without any kind of ideas. Come with a blank state of mind. Then only we can put the words of healing words or strengthening words into your mind. If you come with your occupied thoughts, we cannot solve your occupied problems. So kindly, I repeat it, don't come and ask us, give us some sleeping pills. That is not possible at all. So kindly, don't come and say to us. If you want pills, you can go and directly ask psychiatrist who is authorized people to give a direction towards pills. See, the pills is also not required for a certain period of problems. Pills is not a only solution. Pills is not a only method to solve all the mental illness. Pills is that's all required stage to get pills. For all the problematic or all the psychological problems, only the pills is a ending solution for your problem. Psychotherapist is also an alternate method to avoid pills. Pills is also required not for all the issues. For basic, the neurotic or neurosis problem, in the technical term, neurosis problem can be solved only by therapies, not necessary for the medication. If you go for a psychosis or severity of issues only, you have to go for pills. Even
We
though
have
if you are
two more
taking
questions to go. Let's.
yeah, if you are taking pills, you have to direct in a both track. You have to travel in a two direction. Pills is also required, therapy also required. So individuality of single therapeutic technique or single remedies will not solve the mental illness.
Great. So we have next question by Vasudha. It says, how to feel best happy in a known relationship?
Uh, if it's possible, can you explain it little more? In which aspect? In the personal relationship or in your friendship or in your family factor? Which kind of factors you want happiness? Happy, everybody is happy. Everybody is feeling happiness. Everybody is showing a smiley face. That shows happiness. So, in which factor or which kind of explanation you want in the happiness?
Okay, there is another follow-up questions regarding it. Is focusing on problem solving should be there or should not discuss at all?
See, in the problem solving aspect, in the person whom you are discussing, that is the main factor to be dealt. That's the main factor to be known before you discuss the issue. If it is so trust, if it is so personal, or if it is like very close, very potential, or very secret, or security question, or whatever it is, that has to be dealt with your very close relationship. That is mom, dad, brother, sister. These four peoples are only confidential people in this particular aspect. So beyond these, other or aunt or uncle, grandma, grandpa, or cousin brother, cousin sister, don't discuss your issue. See, for an example, I say A to Z is an alphabet. The person of A, about the person A, the B discussed to C to Z all the alphabet. The A no, the C to Z in that one person comes and says to A that B said about you. Then A knows B. The B whom will suspect, whom he will suspect. So that will be, you cannot suspect in all the alphabets of C to Z. So kindly make a difference whom to say, how to say. Make a clarity which issue has to be discussed with which kind of people. So a very close relationship problem or very close and security questions or close problem you have to discuss with your mom, dad, sister. If you're married, you can discuss with your husband. The next then gets into a relationship of family or whatever it is. If you have them quarrels with your uncle and auntie, they have a quarrels with another uncle. So if these kind of issues has to be dealt with the second circle of family bond. There you have to discuss with these kind of issues. If you have any kind of moments or pleasant moments, or if you have any kind of events in your family, then you can discuss with that issues with your second family bond. Then it comes to a third circle is friendship bond. There you can have your fantasy world, your sightseeing world, your close friendship world, or whatever it is you can discuss. So these kind of differentiations only can give a better understanding of life. Then you can have a lead into a happiness of life.
So conclusion from your answer, I think it can be divided into primary, secondary relationship,
Understand.
and how we are able to develop that root factor called trust. If we are able to trust, we can be, easily able to address our concerns. We can actually understand others' perspective in a better manner. Because there are parts and there are situations in our life when we are unable to solve our own problems. And even if we know the solution, we need somebody to reassure us. So it's important, to actually get known to the factor of primary and secondary relationships. I think we are done with the time, but still, if anybody wants any other explanation or any other doubts, queries left, and then we can move ahead with last words by Dr. Hari Babu.
Okay. So in this event, we have compiled all the myths. We have broken the stigma, I guess. So the people, those who have watched this session, has got some insights about the myth and stigma of our field or of our profession, and difference between the psychiatry and psychiatrist, how to be dealt, how to approach, in which kind of problems, whom to approach. All these basic informations has been spoken in this session. So hope the people have understood, hope the people will approach in a better manner to a better professional peoples. So they will not misguide with any kind of third persons into your personal factors. So this is what we have understood, and this is what we have dealt in this particular session. So hope you all have understood, hope you will take it and you will work on it for your better guidance in your better life.
So, last words from me, keep on encouraging one another each day. It will actually bring happiness, which can also be inculcated in your daily routine with the activity called gratitude. You will feel the change in yourself. We'll try to have some session on this as well, sir.
Yep, definitely, madam.
Thank you so much for joining us. It's been a great session. Thank you, Dr. Hari Babu. You have explained and dwelt with everyone's concerns and issues which came up today. You have a lot of knowledge into the field of psychology with your practical experience. I know you have been working with a government organization, you are practicing on your own, you have your own clinical setup. I know it's overwhelming to find certain time for me. That's been a great event. Thank you for sharing your knowledge.
Thank you for giving me a great opportunity on discussing a particular professional topic to create an understanding, better understanding for the people to know the differences. So thanks a lot for accepting my session in this period.
Thanks a lot.
Thanks.
Thank you everyone for joining. We all can part ways. Have a good evening.